Hello, dear friends. I am Dr. Arun Anand. I have been working for the last 42 years in practice, and I am working as a general physician as well as a diabetologist. Today, I shall be discussing with you regarding pedal edema, CKD, and its causes and symptoms and the treatment. In today's session, we will discuss the chronic kidney disease, which is called CKD, and its association to the pedal edema along with its causes, symptoms, and treatment. First, let us see what is a chronic kidney disease. The continuing and the permanent degeneration of the kidneys is known as the chronic kidney disease. The kidneys are a vital organ in the human body, we all know, and they serve a variety of purposes, including the maintaining the body's mineral and the electrolyte balance, and thereby assisting in the production of the red blood cells, maintaining the good acid balance of the blood, or excreting water soluble waste. Kidneys that have been damaged due to some diseases, they lose their capacity to execute these functions. There are 5 stages of the chronic kidney disease, and we will label them 1, 2, 3, 4, 5. CKD disease, 1, when the kidney is normal and is working more than 90%. Part 2, stage 2, when the kidney function decreases mildly and it works between 60 to 89%. Third stage, when the kidney function decreases and it is mild to moderately, about the working is between 30 to 59% only. Stage 4, when the kidney function severely decreases from 15 to 29%. And the last stage, when the patient is put on dialysis, the kidney failure, it hardly works less than 15%. Since the kidneys can compensate for the loss of the function, signs and symptoms may not appear until the permanent damages occur to the kidneys. So, some of the commonly observed CKD symptoms which we normally see, depending upon the severity, are swelling of the feet and the ankles are the pedal edema, nausea, vomiting, lack of appetite, sleep problems, either he is urinating more or urinating less, diminished mental sharpness, it is also affected, muscle cramps, high blood pressure, and shortness of the breath. So, now we will be looking at the signs and symptoms of the CKD, and once the major symptoms of the pedal edema or the swollen legs occur, pedal edema is the swelling of the feet and the ankles caused by an abnormal fluid buildup in the body, in the ankles, feet, and the lower legs. So, this edema of the foot can be caused with 2 different mechanisms which are labeled for this, and these 2 causes can be either in union or it can be separate also. So, let us see how the pedal edema is linked to the chronic kidney disease. Edema forms in the patients with chronic kidney disease have 2 reasons. Either there is a heavy loss of the protein from the body in the urine, or there are impaired kidney functions. This disease, which we call as nephrotic syndrome, is defined as a significant loss of protein in the urine along with the edema. A decrease in the protein called albumin in the blood results in the reduction of the fluid and the blood vessels. The kidneys can detect a decrease in the blood volume and they start attempting to retain the salt, and thereby it results in fluid collection in the tissues, resulting in the edema. Pedal edema can also occur when someone stands or sits at the same posture for an extended period, which we normally see. If the people who sit for long hours, they also develop pedal edema, but that is not related to the kidney, that is a postural problem. The symptoms of the pedal edema include swelling or puffiness of the tissue beneath the skin, skin that is stretched and shiny, and skin that retains a dimple or pits after being pressed in and around the ankles for several seconds. Let us look at the ways to reduce the pedal edema due to the chronic kidney disease. How we can reduce in this disease. Treatment for edema includes addressing the underlying cause. First of all, we will be treating the underlying cause, lowering the salt intake, and in many cases we use a diuretic which we call as a excessive urine formation drug, which eliminates the excess fluid and it also may be beneficial to use compression stockings, and sometimes we can help elevating the legs also. First thing, we have to reduce the salt intake. Edema can be exacerbated by sodium which is present in the table salt and some processed food which contain high salts. So, reduce the salt consumption, and this can help in maintaining the edema, especially if you are on a diuretic. Use of diuretics, it has a definite role that they induce the kidneys to eliminate more water and salt, and hence reducing the edema. Because eliminating too much fluid may also can drop the blood pressure, so it causes lightheadedness and fainting sometimes. So we have to use the diuretics very cautiously. Using of excessive diuretics may damage the kidney also. Therefore, the diuretic must be administered with caution or under the guidance of a doctor only. After using a diuretic, you may need to empty your bladder more regularly. However, when diuretics are used and prescribed dose, other adverse effects are also advised to the patient what will happen with the diuretics. Now coming to the compression stockings, those people who have edema in the later part of the day, this compression stockings can help them in reducing the edema. Fourth factor is by body positioning. We can elevate the legs above the heart level for at least 30 minutes, 15 to 30 minutes rather, 3 to 4 times a day, and this will help in reducing the ankle and the foot edema. Additionally, elevating one leg multiple times in a day may not be feasible for individuals who are working. We cannot tell them to that they should lie down every 4 hours. So, lastly, it is not always possible to prevent CKD also. We have to control the basic diseases like which are causing this high blood pressure, diabetes, and by controlling these we can get benefit from the pedal edema. If you are a high risk of CKD, you should get regular testing. Early detection of the CKD can also aid the slow progression of the disease. In last of all, I will tell you that limiting the salt intake, choosing foods which are low with potassium, and having a good physical activity can help in reducing the pedal edema which is caused with the chronic kidney disease, along with associated treatment which your doctor advises. You must follow that. Thank you so much.